Even in the global institutions like Harvard, Stanford, they have their business school. Accordingly, they have also their design school. So designing is a very important factor in the business world now. So we have started with very traditional things which are available in Mirpur area. Through that way, we are gaining our experience. We started, and certainly we have to address the attitude of the customer. And accordingly, we may have, it means association with some businesses, design school here, or certainly we can hire it means designer. Even in this plan, there is a salary and on person is for designer. And certainly we will, even the day before yesterday when I was in New York, I saw some very simple and very nice sandals are there for the women. I think that is the it's been attitude of the present day. People want to buy this thing. So since we are in business, so certainly we'll design will be a very important part, and so we will also gradually improve the different types of model of shoes and sandals.
Yes, indeed. If it works, design will be very important, and we can also connect with the resources of the designing ability and skill. Like we have connections with the international design schools around the world, so we can take their help also to design particular type of sandals or particular type of shoes or whatever, and any other people. When you see some good thing is going on, many designers themselves will come forward to help you out to stay at the frontier of the market. Any last question? Anybody else to add? Otherwise, we give a big applause for this project and we wish best of luck. This is a great project and we want to see it happening very soon. And last one, yes, Jahangir Engineering Workshop. It's a group F.
Thank you. Very, sir.
Okay.
Thank you, I'm Wadur Rahman. Now I'm going to report the project named Jahangir Engineering Workshop. The group name is Group F, and the team leader is Nazdin Sultana, Honorable Managing Director, Grameen Communication. And the grading code is a very good project. And the issues of examine, does the project clearly state the primary objective? Yes, it is. And list the subsidiary objectives. Yes, it is, because he is helping the local agriculture tools about the farmers, that's it. And does the project service well defined? Yes, it is. Does the business plan appear to be adequate and realistic? Yes, it is. And does the entrepreneur looks dependable? Yes, he is, because he is the only one earning person in his family and he is running this business last 3 years. Does the project size looks appropriate? Yes, it is. And does the break-even point look achievable? Yes, it is. And recommendation for the projects, actually this is a very good project and ready for serious consideration with some financial projection review. Just everybody suggested that just need to review the financial projection. That's all about the projects. Thank you.
Thank you very much. Let's give a big applause for them. Now, questions. Any comments, questions for Jahangir Engineering Workshop? No questions. So he has done everything to convince the whole group. Let's give him a final applause for him. And with this, we conclude right on time. As we planned that we'll conclude at 2 o'clock, and it's about 2 o'clock exactly 2 o'clock right now. And we have some presentations now. Before that, we have a round of applause for all the projects so that it come to actual implementation as soon as possible. Let's give a big round of applause. Thank you. Now that there's a presentation from Grameen Communication. It's a portable health clinic and call center. This is a kind of idea in the process, in the making as a social business. They want to give you a glimpse of it before it is presented as a business.
Actually, sir, this is a demonstration. So here we are demonstrating our portable health clinic. And
We have a big patient here who's patiently waiting here and all the doctors around.
Actually, we have a system of health data recording. So some of the person of Grameen Bank complex or remote sites in Chittagong, Thakurga, in different project area. So we have around 4 health data last 2 years. So it's very helpful for the doctors to suggest our prescription. So now we are demonstrating our portable health clinic project. Sorry for the new personnel who are not present in our last session. So today only we demonstration our health system.
we demonstrate this project in the 9th design lab by Mr. Ashir Ahmed. Now today this is actually the physical demonstration, the process, how they work. The 2 health assistants, Ruba and Rehna, they will present, actually they'll show the demonstration how the total portable health clinic, it works. And everybody can see from the big screen, here they show you.
As I understand, the gist of the whole thing is, patient is somewhere in Bangladesh, way out, is not here. But the doctors are here in this building right now. How they are treating or getting information from him to the call center, and then they are negotiating or discussing the health problem with the patient. Is that what, am I correct? Yeah.
So good afternoon to all.
So there's a big distance between the patient and the doctors. Yeah. This will be with the patient, right?
Yeah.
The machine will be with the patient. There's a machine, there's a machine here. Can you lift it? Yeah, there's a machine which is a key to the whole thing, which has been developed over a period of time along with us by our friends in Japan.
Actually,
This is the whole diagnosis. You can see it on the screen. This is the whole box. If you add it up, this looks like this, like a briefcase. All the equipments that you need in a diagnostic center are here. So this box will be in the village, and the patient will come. All the information will be monitored and also stored in this machine, which will be transmitted to the doctor's screen. So that's the thing, that the 2 things, patient should have been somewhere else and doctor should be here, so that we can see the distance. Here everybody is in the same place, so people cannot really figure it out. So these are 2 things. The doctors are not here. These are all the patient related things. Doctor is a god of the voice of the God.
The cloud actually.
It's in the cloud.
Virtual.
It's a virtual. It comes from there. So without doctors, how you treat a patient? Getting all the services of the doctor and all the diagnostics information of the patient. Let's try.
So good afternoon to all. I am Rehana Akhtar, working as a health assistant at Grameen Communications. So welcome to our demo. Thanks to all.
Good afternoon, everybody. This is Fazilatul Nessa Rupa. I am working here, health assistant at Grameen Communication. Thank you.
These 2 girls, they are the graduate of Grameen Caledonian Nursing College. They are Grameen Bank's borrowers' daughters who have been trained as nurses. They graduated as a nurse. Now they are working with Grameen Communication. So that they have their own identity to tell about.
Now Labib checked his health. Our health assistant, they are trying to get the blood pressure, and all our devices are automatically connected to our server. So the data, we do not need to input our data to manual. It's automatically transfer the data through BAN technology. It is called Body Area Network. So just show. So you can see our health demo in the large screen. Yeah, still measuring. So it's automatically transfer the data to our system.
His body information is transferred into the computer, and computer also makes it available to the
Yeah.
doctor immediately. So there is no time gap.
And we have a call center, it is live now, so doctors can see this information instantly. And after checking his all health checkup, we can show how remote consultancy is done in our program. And after consulting, doctor can make prescription from his call center, and this prescription is remotely we can provide to the person. And just see this patient or this person is not now in urban area, maybe in remote area, no problem. Now weight measurement. So this weight machine also Wi-Fi band connection. So this data automatically transferred to our local server and via local server to our system.
They are trying to draw your attention that no manual entry of the data information. Whatever information is generated from the patient automatically goes into the computer, and computer transmits it to wherever it's needed to be transmitted, and the doctor looks at it and analyzes it, and then finally he writes his prescription, and prescription is issued right here on the other end, in this end, not at the doctor end but at the patient end. Prescription is generated, and the patient, as I'm repeatedly mentioning, is in a remote village. So he gets his prescription from the top doctor of the country without seeing the doctor physically, but without having to travel all this distance. And this equipment has almost all the necessary diagnostic tools in that little box.
And he can, sir,
Oh,
he,
now, doctor,
he can
he'll-
speak from here to there.
Now
by
he'll
his
talk to the
Skype.
doctor on the phone.
And one more thing I need to add with SAR, that is our system has basic intelligence to analyze the data. Because before transfer to doctor, this data automatically shows the category of that person. If the blood pressure level is high, then automatically show this is high, or that is by color. If it is green, then he's very good in health. It is yellow, then some problem. And orange mean more problem, and red mean critical situation. So by color, doctor can easily get it. Angular করে দিও, angular. In Bangla.
প্রেসক্রিপশনটা কি বাংলায় হবে না ইংরেজিতে হবে জিজ্ঞেস করুন।
Actually in a bilingual mode, in the medicine name in English and the advice and the instruction in Bangla.
Yeah. This is the prescription, it's a printed prescription, very neatly done in Bangla. Bangla prescription, everything, not only it gives all your information that is collected is also in the prescription. So that anybody who looks at it can
Now call center, I'm sorry, maybe you all cannot see it,
She is the
but
doctor.
let's see. Now it's from our call center, doctors is there. Make it full screen correct. Okay.
এটা সরাতে হবে। এই ফোনটা মাইকটা নিচে করে দাও। হ্যাঁ।
জসিমের সামনেটা নামাই ফেলো।
She is a doctor, she is sitting in the call center and analyzing the Labib's report.
So you can. So this is very personal information, and we please do not listen
Pay
to
me
this
attention.
discussion.
So what were the main things that they were looking? I saw blood pressure and oxygenation and the
Actually,
blood.
we
What
have
was the main one?
13 list of 13 machine at this moment. Okay. So at this moment, we are providing basic healthcare checkup. So it's including blood pressure, temperature, pulse rate, arrhythmia, and BMI, waist-hip ratio, pulse oximeter, and blood glucose, blood grouping, hemoglobin. But hemoglobin is optional because hemoglobin is very expensive. Urinary sugar, urinary protein, urobilinogen, and ECG. ECG also optional. If doctor asks us to do it, then we can manage it. Yeah, we have the capacity.
They have the capacity of ECG, and these are the items that are included in that box. So that box anybody can carry is a portable box, so that you are actually carrying the whole diagnostic center with you. And it produces result right there in that box. You're not going someplace else to get the result. That's also important. And the last we discussed to add one more equipment into it, ultrasono, so that it's also ultrasono equipped. So if you need to do the ultrasono, you can do it right there. So you don't have to get to the patient. And similarly, the image will be immediately transferred to the doctor. If you do the ultrasono, image will be transferred instantaneously. Yeah. I think Farid wants to say something.
No, I was just asking how about the cost?
Don't talk about cost. That's a trade secret here. It's expensive right now, but if you order large number, since you will be producing it ourselves, so cost can come down. So this whole thing developed by us, by actually Ashir. Dr. Ashir, who was present here the other day, it's a Bangladeshi professor in Kyushu University. So he has been working with the Grameen Communications for the last several years to develop this, calling it doctor in a box. So this is what, and is actually using it. It's not something that we keep it in the laboratory. It's already being used for remote diagnosis, and the call center actually exists. It's not a kind of imaginary call center. This doctor is actual doctor. She is taking calls from the patients. There are 2 machines now working. How many machines?
5 box. We have 5 box.
5 boxes, 6 boxes. 6 boxes are already in use in different parts of the country, testing it out, how it works, how the patients feel, and so on and so forth. So, but it can be brought down to very reasonable price. It should not be, it has to be developed as a social business, so we have to make sure. One idea is that the box will be rented out. You don't have to buy it. It will be rented out, you pay monthly because of your patients, you collect money from the patients, and you see whether it's worthwhile to do that, whether patients are willing to do that, because with this box, a doctor is attached. So whatever is happening, you are doing it in collaboration with the doctor. So everything is combined, whether the patient is willing to pay the amount which will cover all the cost. Yeah.
Health booklet, the person with, there is no problem like green and yellow, but not now in a patient, but we provide a health booklet in local language so that the person who are not in danger level at this moment, but know how to maintain or keep good health, so that in future he will not in trouble. And actually our goal of this project is preventive health care, not for the patient, but who are now at good health. We can ask them how to keep good health, because our doctors are very limited, so we don't want to bother our limited number of doctors with new patients. So that is our goal actually.
Thank you. That's it?
Yeah, that's it. And actually at last we want to know our customer feedback from actually Labib. It's his 3rd health checkup. So some of the Grameen employee have 4th or 5th health checkup also with our project.
This is also important, the last point that he made, that he is the 3rd checkup, somebody had 4th checkup. All is stored.
All is stored.
He doesn't bring anything from home. You just go to the patient number and all the previous things, so you build up a history of your problems. So, and this can be transferred to any place because it's in the cloud. So it's not something you have to carry, you have to contact them to release. It's not like that. So this is available to him. He can share it with any doctor anywhere he wants to share for any problem. So it's good to have a regular checkup with this, so that you build up your health history. Any problem arises, you see it ahead of time, or if it happens suddenly, you see the history of it. How did it happen? Which was the point which was missed before? Which one was the one that we should concentrate now? This is a very important point, because most of the time doctors don't have a history. They spend a lot of time trying to understand your history. But here is in concrete numbers. The history is told and all the graph is made. Everything is analyzed. So that's it. Now the history of Labib. if you want to hear the history of Labib.
Thank you. I have been sort of a regular customer. This is my third time. And so that's the thing. I think it's a pretty terrific way of sort of measuring everything. And I guess the cost is something they're going to work out. And if it's something that can be done at an affordable thing, I don't think anything could be better than having such a thing at the most rural areas of Bangladesh.
Thank you.
Thank you very much.
It will be much cheaper than building a whole diagnostic center.
Absolutely.
You get the whole diagnostic center in a much more efficient way. And it also in the prescription, it shows you your health conditions with giving with the color code, green, red, yellow, and all kinds of things. So you know immediately before you read what is prescribed, what is your health situation. So Labib has lots of oranges. Okay. Good. You will make them green very soon. Pardon me? It can be done any language. It can be done any language. Today it has English on one side, Bangla on one side, that's all. But it's subject, it's a computer does everything. Nobody has to learn anything. To computer, language doesn't mean anything. It only knows a code number. And code number gives everything, and you print out the whatever language you want to print. Yeah. Okay, so we have another demonstration. This will be coming up as a social business. So we thought this is something. They didn't present it because they didn't want to come up with a big number for the box. So because they have to show that it comes down and then it becomes a social business. Once it becomes a social business, we are in it. You want to conclude, Nazreen? This is
still in the model, research model it is. We have doing some research. Already we diagnosis the 20,000 people. So if you want to, you can go to the other room, you can check yourself.
It used to be, in every social business day, you have seen this. But you have seen this is a big house, big room with all the equipments. I said, it's no fun having all the equipments in a big room. If you can put it in a box, then you have done something. So they worked very hard to put everything in a box. So this is the box finally they came out with. Yeah.
Sir, I want to sum up. We are tagging 5 things: automatic diagnosis, automatic data recording, live record sharing, and real-time conference, and online prescription. Real-time doctor conference. These are the 5 things we are doing by this portable health clinic. This is.
Well, let's give a big, big applause. Very good. Next time you come for the lab, you have to do the testing. So that every time you can get a checkup. Let's see if she can arrange it. But you have to pay for it, unfortunately.
These are only 10,
it's free,
50 taka, I think, registration.
Wow,
50
this is
taka
so
for
cheap.
the,
If you can set it up as a separate activity on the corner, so people who come here can have a quick checkup and keep it stored, so that every time they come, they can do that. See?
Yes, sir.
If
Yes,
you can
sir.
do that,
We'll
then we
do
pay.
this.
Yeah, just have a checkup.
And after this meeting, sir, I will request you to see our doctor is waiting
Call center. Okay, I'll go and see the call center. So we conclude this part, and then we move on to some announcements.
Thank you, ladies and gentlemen. In fact, at the 9th and the 10th design lab, we discussed a project called Oroni Social Business, which focused on producing mustard oil. Today, that project is coming to fruition, and we are very happy. We have been effectively working behind this extensively for the last 3 months. The entire project is being projected as we speak. The partners in this project are Grameen Telecom Trust and Eco-Social Development Organization, ESDO. For the last 2.5 decades, this organization has been working in the northern part of Bangladesh, working in terribly poverty-stricken areas, and they've done a wonderful work. They have been awarded by many institutions, including Citibank NA and the government of Bangladesh, and we are proud to partner with them in starting this business. Can we have the next slide? This essentially outlines the production facility that currently persists there, and of course, ESDO is a big name in North Bengal, where they have a big office and they have their own Eco Pathshala, which is very popular in that region. And as we sign this agreement today, we sincerely hope that we'll be launching a social business which will actually bring very good results in both financially and social impact over the coming years. Thank you very much.
So this is the signing ceremony. So you are the witnesses. So probably you'll have to sign everybody. Okay.
Ladies and gentlemen, just to brief you once again on what this business will be doing, it's essentially a social business that will start in producing mustard oil. The social impact of this project essentially entails inclusion of 1,000 indigenous people who will be working as farmers, and the mustard will be procured for them, and at least taka 5 per kilo will be paid in addition to the market price. So, and it's located in Thakurga, as I've said before, a region that has been severely depressed economically and has gone through a lot of, both in terms of weather anomalies that have happened there, and the fact that a lot of poor people live there, and the fact that over the last 10-15 years, or in fact more than 2.5 decades, Eco-Social Development Organization has dedicated itself in improving the livelihood of the people there. Yes. And as I said before as well, there will be at least 1,000 indigenous people who will be working in this project as farmers, and we sincerely hope that their lives will be improved by our efforts.
Thank you. At first, I would like to convey our heartiest gratitude to Nobel laureate, our respectable sir, Professor Muhammad Yunus, and as well as all team members of Grameen Telecom Trust for creating a great opportunity for ESDO as well as the extreme minority community people of the northern part of the Bangladesh. No doubt it creates a new avenue not only for ESDO as well as for the extreme minority community as well as hardcore poor community, because through this way the social business, it creates an widened opportunity in terms of the wage employment as well as their self-employment. And it's a great opportunity for us, as because this is our great inspiration, our Honorable Sir Professor Muhammad Yunus, and this is the new days for ESDI. Really we mean it, because this is the new days, the new history of ESDO. We start a new avenue, who is finally contributing significantly and creating a positive enabling environment for the poorest community of the Bangladesh. Thanks to all.
Thank you.
Thank you very much. We are just left a little bit with the signing. Right. We have the entire team of Grameen Telecom Trust and ESDO as well. If the team members of ESDO could please introduce themselves.
Thank you. Assalamu alaikum. This is MD Rafiqul Islam, Assistant Program Coordinator, Program Support Unit, Eco-Social Development Organization.
Thank you. I am Atul Kumar Mozumdar, Program Coordinator, ESDO.
So another real project signed, now it will be in action. All the money will be flowing, and all the things that we hoped will happen, and it will start happening. And we'll come back and report on it as we go. And one of the things probably would like to know as it proceeds, so that the group as a whole, the lab as a whole, get some pictures, kind of a pictorial presentation rather than just numbers. Numbers is very important, but we also want to see, since we cannot go to all those places, at least we'll have them visual images from all those places where they work.
This business has a seasonal implication.
Yeah.
That's why by April, it has to be implemented. That's why from next week it will be in operation.
The agreements are signed, so can we just please exchange them right now so that we can officially inaugurate the project? Thank you. Right. A huge round of applause, please.
So we go to the next one, next launching. Is there next launching? Okay. Yeah.
The next launching will be with Green Savers Association. Could you please ask Mr. Rani Hassan to come up and take his seat so that we can commence with that? Essentially, this social business will be creating a mobile plant nursery and clinic. Green Savers Association since 2010 and 11 has been working tirelessly throughout Dhaka in promoting the green economy, and they have been working in promoting greenery throughout Dhaka. They firmly believe that a cleaner and a greener Dhaka will change the future of not only this city, but all the dwellers here too. They have a strong nursery which they have been promoting for the last 2-3 years. Now they're converting a portion of it into social business where they'll be introducing mobile vans which would be selling plants throughout the country. And along with it, they also strive to provide agricultural extension services and of course, selling of fresh produce. Can we have the next slide, please? Green Savers Association is a national award-winning association. It has been awarded by the Honorable Prime Minister of Bangladesh for being a successful youth organizing association, and it has also been awarded the best performer in terms of green conservation from the Honorable Minister of Environment and Forest.
So Ronnie is the nursery guy. He goes around, puts all the plants around your house, and then make them produce things rather than just flowers. They also get some vegetables, some green chilies and all this stuff. So he has been very successful in having a kind of corridor garden or your veranda garden or inside the room garden. Yeah, here you can see some of the pictures. Let's give a big applause. Signing. They have to go through many signing ceremonies. Only 2 are presented here. So that these are very special projects. So we thought we'd share with everybody else. Otherwise, all those 36 projects which are in operation, they had to sign each one of them in this elaborate process, with all the documentation and everything. Great. Now
the documents are being exchanged. Can we please have a round of applause?
Good afternoon, and this is Ahsan Roni, presenting Green Savers and performing social business. And from now on, this is our responsibility to run the social business, to establish this idea. This is already established idea, and to spread this idea to the mass people. That will be our social responsibility, then business responsibility in a whole to go to the mass people and to let them know what in social business what we are doing. We are doing social work. We are supporting you with plants, doctor, and many other facilities. You can, if you want to make your surroundings green, then come to the arena, come to the parasol of social business and get our help. And we are always at your service. Thank you very much.
Thank you. Fantastic. Congratulations.
Thank you, sir.
Very good. Thank you. Conclude the signing ceremonies, and we don't have any formal agenda with us right now. So we'll now have lunch together. And if anybody wants to leave, can leave. People who would like to have lunch here, we will be very happy to have lunch with them. But we'll continue to talk informally. This is not included in the formal session. Formal session, we are concluding. This is the 13th Social Business Design Lab we have just concluded. And we want to say thank you to all the people, all the participants who are on the internet, on the live stream around the world. You have taken lots of pains to watch this for all this period, and we appreciate your attention and interest in the whole subject. And we hope to get you back again on the 14th Social Business Design Lab, and also particularly on the one Social Business Day on June 28th. There will be a Social Business Design Lab also on that during the day. So we thank you, all of you. Goodbye, thank you, and good night, and good morning, wherever you are. Bye-bye. From all of us, we give you a big applause for all of you. Thank you. Thank you.